In 2022, Lambeth recognised that life expectancy and healthy life expectancy had declined. This called for action. We put together a bid to secure £5 million in health research funding over 5 years.
That's me in the video. Yeah, I know, I've grown.
Lambeth's film bid started with the understanding that to reach our full potential, we needed to engage in research to comprehend the true needs of our people.
Lambeth HDRC is a health determinants research collaboration. It's a way of building research infrastructure for local government which looks at what we call the wider determinants of health. So these are the things that affect people's health but aren't linked to healthcare specifically. The opportunity that we've got now is to understand much better the things that will influence people's health longer term and then to do something about them.
Lambeth is among only 30 local authorities in the UK that have achieved this funding. We achieved this together with local people, staff, and our partners at King's College London and Black Thrive.
Lambeth HDRC is building connections with all of these other elements in the local community through a huge infrastructural project. So we have in South East London one of the largest mental health trusts in Europe, and that trust has electronic health records where people have been de-identified, and so we're linking that data to social care data. The exciting thing about that is that probably for one of the first times ever in Britain, we'll be able to bring together two really important elements of data that can tell us about many questions that can then be used to help improve care as well as experiences in both the social and the healthcare system. And I guess the exciting thing about how Lambeth works is it's all done in partnership with communities.
What's the point in us going forward and linking this data if we don't understand what the community really need from the data from projects going forward? In order for us to do that, we can put together workshops like this that allow us to hear their ideas, their thoughts, and their irks with the system at the minute.
I think one of the things is really important is building relationships with communities and individuals, and I suppose I'd say that in the widest sense in terms of residents, citizens, businesses, schools. I think it's really important to conduct as much of that research, that kind of knowledge that is already existing out in the community, because people in the community are so knowledgeable and so they have the skills and expertise in knowing what the right solutions are. You know, there's lots of different perspectives in solving these deep entrenched problems that we have, and not one person can do that. We all need to be part of a team, all with our different views and opinions.
Our goal is to continue developing training for all staff, helping them embed research into their work, ultimately leading to better service planning and decision making.
So the lasting imprint of the work that Lambeth Heart involved with is hopefully to bring in a stronger infrastructure so that work can be done to help the services around Lambeth.
We need to really stay true to what we set out to do at the beginning in our ambition, which is really around making sure that we are working to address the social determinants of health and that we are staying true to our ambition to improve the lives for people in Lambeth.
Like me, the Lambeth HDRC project is growing with our future. We are building a healthier, stronger community together, and we need your support.